Hey, it's Mo Egger. Summertime means warm nights on the outdoor patio at Long Neck Sports Grill. They've got 4K TVs outside, so you don't have to miss a game. Awesome wings, Northern Kentucky's best beer selection, great service, 3 terrific locations in Northern Kentucky, and maybe you could have a Long Necks in your neighborhood. Your chance is here. Go to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often. We chat with one of the experts from OrthoCincy, Orthopedics and Sports Medicine. What we love about OrthoCincy is they got specialists all over the tri-state, locations all over the tri-state, and they offer walk-in orthopedic urgent care during the week, 9A to 9P, Saturdays 9A to 1P. Walk-in means you don't need an appointment. You knew that already. Learn more at OrthoCincy.com. That's OrthoCincy.com. We've got to talk Tee Higgins. Dr. Matthew Grunkemeyer is with us. Let's start with what Tee said. Last week, he, on Thursday, talked about how amazing he felt, and then he didn't play on Sunday. So how does that happen?
Yeah, I don't know. I mean, with a hamstring injury, he may be feeling good the rest of his body. Then when he goes onto a full sprint or gets down in a crouch position, it tweaks again. That could be the case. He's probably trying to do a lot of what we call active rest, where he's not pushing himself super hard in practice to not re-injure the hamstring. But then when he gets to a game or game-level simulation, he's going to have to push himself, and that's when it'll tweak at that highest level.
I feel bad for him, and obviously there's a lot of noise around Tee because of his contract, and you hear all the time maybe the Bengals don't pay him because they're concerned about the number of hamstring injuries that he has dealt with. Why would someone like Tee have this keep recurring as opposed to somebody else who doesn't?
Yeah, it's hard to say. I think just with his position, he is having to crouch and flex and go and put those hamstrings under stress so regularly. And it's kind of like this, man. Once you get an injury, it heals, but it heals kind of with scar tissue sometimes. So it's easier to kind of re-injure a said muscle, such as a hamstring.
So for Tee specifically, walk me through what the coming weeks are going to look like, the treatment options, and I guess best guess, and I know we're guessing right now, best guess as to when we might see him on the field.
Yeah, that's really hard to say with these injuries. They're notoriously difficult to guesstimate how long you're going to be out with one. Some of them depends on the location, if it's in the muscle belly or if it's closer to one of the tendons on either side, closer to the knee or up closer to the butt. It's really a case-by-case basis. So I just can't give you an exact timeline, but usually for full recovery on a severe hamstring injury, you're talking 4, even as many as 8 weeks.
I think a lot of us associate pulls, hamstring pulls specifically, I guess, with colder weather. Obviously, it's not been very cold. It's cooled off a little bit, but do we worry about Tee when the weather does start to turn and the temperatures do start to drop?
I don't really think that's an issue here. These guys, these NFL players, are so highly conditioned that the temperature is really not in effect. That's more for you and I, the weekend warriors, the guys who go out and, play a softball game and pull their hammy or something like that. I don't think that the temperature is really at play here.
All right, I want to ask you about Kris Jenkins, a rookie defensive tackle from Michigan, second-round choice, draft choice. He didn't play the game on Sunday. We find out a few days before the opener that he has a thumb injury that's required surgery, and he hasn't been placed on injured reserve. He could conceivably play this week. So it might be a dumb question, but I'll ask it anyway. What kind of thumb injury requires surgery but isn't so severe that he could conceivably play as soon as this Sunday?
Well, I'm assuming he's going to play with some type of protection. And given that it's not likely that, given his position, that he uses his hands to catch or throw the ball, I think it is conceivable. All the time we have thumb injuries in athletes where we'll put a cast on or potentially even perform an outpatient simple surgery and then cast it to protect the thumb. I'm assuming he's going to have some type of protection on that thumb if they're allowing him to play so soon after surgical treatment. Is
this maybe as much about pain tolerance as anything if he does play?
Sure. Yeah, it's a painful injury, but the injury hurts once you repair it. I'm assuming it's a ligamentous injury and not a bone injury. Once you repair that ligament, it actually feels better once the swelling goes down after 3 to 5 days. Probably feels better, feels a little more stable. And he's a tough guy, obviously. All these guys are who make it to this high level in competition. So I think he'll be able to handle it.
One more injury to talk about. It's a baseball injury. I guess it's more a guy who has had a lot of injuries over the course of his career, and red shortstop / second baseman Matt McLain. He hasn't played at all this year. He's had rib issues, oblique issues, shoulder issues. They're still leaving open the possibility that he may play with basically 2+ weeks left in the season. From a medical perspective, understanding what he has gone through, does this make any sense?
Yeah, I kind of have a hard time. There's sometimes other things at play that we don't understand, whether it's players' contracts or other things. But from a medical pure perspective, I would say give it a rest and try to lace up again in 2025. But that's just me talking from the outside.
Yeah, and you have to factor where the team is in the standings in that conversation as well. Awesome perspective as always. I do appreciate it. Thank you so much.
All right, have a good day.
All right, most definitely. Dr. Matthew Grunkemeyer from OrthoCincy's. We say it every week. The great thing about OrthoCincy's is they have specialists and locations. You can't have specialists without a location. All across the tri-state, this includes walk-in orthopedic urgent care, weekdays 9 a.m. to 9 p.m. and on Saturdays 9 a.m. to 1 p.m. In Edgewood and Anderson, it's easier and cheaper than going to an ER whenever you have an urgent orthopedic injury. Just go to OrthoCincy.com. That's Ortho, CINCY.com. Hey, it's Mo Egger. You've heard me talk about Long Neck Sports Grill for a while. There's no better place to hang out during the summertime than the Long Neck's patio. They've got Northern Kentucky's best wings and awesome beer selection, 4K TVs. It's a great place. But have you ever thought how cool it would be to have a Long Neck's in your neighborhood? Well, your chance is here. Check out the franchise opportunities by going to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often.